Thank you. A grim anniversary in the pandemic today. 2 years ago today, the world recorded its first known case of COVID-19. Since then, the virus has killed more than 5 million people, infected nearly 255 million, and has taken a toll on all of us. And that includes children. Just like adults, the pandemic has not only affected them physically, but also struck their mental health.
Tonight, CBS 4's Karli Barnett has some staggering data that shows an increase in child emergency room visits due to mental health struggles. Karli?
Well, Elliot, Lauren, some pretty shocking numbers to share with you tonight. Here at Nicholas Children's Hospital, they say they are seeing their highest ever number of child and teen patients when it comes to the effects of these mental health related emergencies. And they want to sound the alarm for parents tonight so that they know what to look for and provide some solutions. The pandemic brought plenty of changes to jobs, schooling, and day-to-day life. And as children learn to navigate and cope with it all, for many, it's taken a toll.
Some people are referring to it now as a parallel pandemic of mental wellness.
It's something mental health professionals at Nicholas Children's Hospital are sounding the alarm about, with an unprecedented number of kids and teens showing up in their emergency department due to mental health related struggles.
Our highest ever year, we are already 400 patients over that highest year, with November and December not even calculated to date.
And those numbers do reflect what national data is showing. According to the CDC, the percentage of hospital visits for children with mental health emergencies went up 24% for children ages 5 to 11 and 31% for children ages 12 to 17. There was also a 50% increase in suspected suicide attempts among girls ages 12 to 17 and a 4% increase for boys the same age.
They're not only not having the outlet of school, socialization, connection in that regard, but they're also dealing every day with no break with whatever's going on at home, which for a lot of families, there's a lot going on.
Clinical psychologist Dr. Ana Maria Ojeda says they see children and teens with anxiety or depression expressing symptoms like shortness of breath, stomach pain, and heart palpitations, and also thoughts of self-harm.
It's not uncommon to see children and adolescents internalize and absorb a lot of what's going on at home. And really, they don't really understand financial stress, but they know it's happening. And so that becomes a stressor. And the worst part about that stressor is that they have nothing they can do about it.
Social media, they say, can also have a major effect on mental health, with children spending a lot more time communicating virtually.
With social media, this is their way to connect to other people, and they're often being exposed to things that their minds are not capable of processing yet.
There are ways to help promote mental wellness at home. Those include setting social media boundaries, designating a time for open, judgment-free communication, giving your child space to process emotions when they ask for it, and being direct when asking them if they have thoughts of self-harm.
It's not you take a medicine or you go into the OR, you come back and you're done. It's a process. You didn't get here in one jump, and it's not going to revert into a better situation in one jump.
Certainly a lot of factors here, a lot involved in all of this, but there is a bright spot. Even though those numbers are increasing, Dr. Ojeda said at least it is opening the door to have this conversation and to educate about mental health in ways that they hadn't been able to do before. Now, we're going to have links to resources on our website, cbsmiami.com, which will be up this evening. But for now, live outside of Nicholas Children's Hospital, Karli Barnett, CBS 4 News Tonight.